Yay Networks.
Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban. And today, on this episode, we're going to do some more Q&As, questions and answers from you, the listeners. You guys have reached out to me on Instagram and other outlets on social media. We've jotted down your questions, and Maria, my famous producer, and I, we're going to fire through them and see if we can answer as many of them as possible. So check it out and pay attention, because I think you're going to find this to be interesting.
Okay, so we're going to start with our first question. We didn't have a name for this one, but they asked lymphatic massages after tummy tuck. I see it recommended all over YouTube videos. So
lymphatic massages in general are recommended or suggested or advertised after liposuction, after tummy tucks, after a bunch of procedures. I personally am not a fan. I personally don't believe it does anything. I think it's a big gimmick. I think the idea is, and it sounds good, that someone is going to massage out the swelling because your lymphatics need assistance and sort of you're draining out the swelling. I'm not a believer. I think, number one, whoever is doing this is usually a poorly trained individual. Two, I think that they're going to potentially cause damage to whatever was done, whether that be a tummy tuck, breaking sutures, dislodging things. Three, you can't just force fluid out. In other words, there's a sort of a organic way that fluid moves through the body. And obviously, immediately after surgery, you're going to get swollen. So I have historically not recommended lymphatic massage to my patients. I mean, at the end of the day, they can do whatever they want. And I think that by and large, it's mostly just hype. So I would just save your money.
Okay. The next one is from Lainey Olympio.
Lainey Olympio. Okay.
Lainey Olympio. Is it possible to have a lower facelift with no anesthesia? My first question is, why would you want to have it without it?
So I think that's a really good question that you ask, Maria. Why would this woman be asking that? And the reason she's asking it is that there is a substantial number of people who would love to have plastic surgery, but their greatest obstacle is fear of anesthesia. They're afraid to go under anesthesia. So they think they're going to die. Something horrific is going to happen. So as a result, we get asked all the time, can I get a breast aug with under local? Can I get liposuction under local? Can I get a tummy tuck under local? And having a facelift under local is no different. So the answer is you can have a facelift with conscious sedation and local anesthesia. Conscious sedation being some drugs like narcotics or a Valium or something, and your surgeon can accomplish the facelift. The question isn't, can I? The question is, should I? Yes, you can, but I am not a fan. Usually those are called lunchtime facelifts. Usually they're done in procedure rooms. Usually they're done quickly. Usually they're minimally invasive, meaning you get minimal effects. You know, in order to do a legit facelift, by the way, a lower face is the same thing as a facelift. They're all just the same terms. In order to get real effect, you need to get down and under the muscles in most instances, at least do some aggressive work to get some serious change. And it's not advisable to do that under local. You can run into bleeding and things of that nature. So while it is possible, I'm not a huge fan. What you really want to do is address, why are you so scared of anesthesia? Statistically, if you go to a safe surgeon who uses a legit facility and has an amazing anesthesiologist, the risk of an anesthetic complication is probably a fraction of what it is the risk of getting hit by a car on the way to your procedure. So most people's fear of anesthesia is irrational, like fear of flying, and you should be looking into that rather than figuring out a way around the correct procedure.
Okay, the next question is from Naomi Lily Lands.
Naomi Lily Lands. I like that.
Eyebrow lifts, can this be achieved by Botox?
So Botox, it's interesting. I get people who come in for Botox and they say, I'm here because I want my eyebrows elevated. Now, how does that happen? Botox is designed to paralyze muscles which then make wrinkles that those muscles would create go away. So Botox eliminates dynamic wrinkles when you paralyze muscles. So how the hell do you get a brow lift? Actually, if you inject Botox directly over the brow, you paralyze the muscle that elevates the brow. And not only do you not get a brow lift, you get brow sag. There are many, many people listening who've played or toyed around with Botox in a shitty spa, and then they get a drop brow or they feel like their brows are heavy. So how do you get a brow lift? It turns out that you get a brow lift or the effects of a brow lift by injecting Botox in the middle of the forehead and injecting much less or no Botox on the outer aspects of the forehead. And therefore, the middle doesn't move and the outer part moves normally. And you get a differential elevation of the brow on the outside. And that makes it look like you have a brow lift. So it's actually a byproduct of injecting another area, and the area that isn't injected is lifted. Does that make sense?
Yeah.
All right.
But I notice a lot, at least here where I live, these women with these eyebrows like up to here.
So that's exactly the case. So people go in, they say someone, they're like, oh, I want my brows elevated. And they do what I just said, but they do it so extreme that they look crazy. Their eyebrows are like shooting to the sky. So yes, you can get it, but you got to make sure it's done very appropriately.
Okay, this one I think is one of my favorite questions. Johnny Rotten 7.
Johnny Rotten 7. Okay.
How do you make sure a man's nose is not too feminized during rhinoplasty?
So that's an excellent question. I always tell my male patients for rhinoplasty, it is much easier to create a beautiful female nose than a male nose. Because in a female nose, you have many, many iterations that still look feminine. Even overly done noses, that means super scooped and super rotated, a woman can still look attractive, although looking fake. A man's nose has very few iterations or very little room for error, because the slightest scoop of the bridge or the slightest over rotation of the tip or the slightest over narrowing of the tip leads to a feminine look. So you can't make a ski slope nose, you can't make a nose that looks like a pig, and you can't make the tip look like a little point. Any one of those things will ruin a man's overall appearance. So the answer to your question is skill. Skill is what you do in order to prevent a man's nose from looking too feminine.
And should they probably, when they are researching for their doctor, look at many samples of rhinoplasty?
Oh, no question. If you go to a gallery and you're looking at a surgeon, if you're a guy, you should be looking at only guy photos, period. I don't think that does you any good to look at 200 female noses.
Yeah, it doesn't make sense.
Because they're so unrelated in terms of the aesthetic. And you want to make sure whoever does your nose has done many, many examples of noses you like, men.
The next one is from Shanna Beckett Wyatt.
Shanna Beckett Wyatt.
When are revisions necessary?
Well, I mean, it's a general term. A revision occurs when the patient is dissatisfied with the outcome. I mean, it's just that simple. You go in, you get something done, and you hate it. You dislike it. You're unhappy. It's not what you anticipated. Now, sometimes that's because you, as the patient, are difficult or unrealistic. Sometimes it's because what was told to you was not delivered, and the surgeon did not execute what he or she had said. And sometimes you have a complication. Something goes terribly wrong. So the reason for revisions is pretty broad. Most common revisions, the truth is every surgery has its revisions. I do a ton of noses, so I see a lot of nose revisions. I do a lot of breast revisions, My God, there's amount of unhappy people from liposuction is just too many to count. So the truth is, as plastic surgery has become more and more popular, as more and more people are getting it, as more and more surgeons who are underqualified and untrained are doing it, so are the number of revisions.
But I thought you said in liposuction you couldn't do revisions.
I didn't say that you're going to get a great outcome. I don't do liposuction revisions. I barely even do liposuction to begin with. But people will go and try to get the revision done. And what do they normally see happen? Usually it gets worse.
Mm.
So revisions are very unfortunate because, many times you go in for a revision only to find out things are worse. Not good.
That's sad. You spend all the money and you're usually doing it because you want to look better, not worse.
Exactly.
Okay, Mrs. Lauren Gray.
Mrs. Lauren Gray.
Yeah. Belly button results. What makes it an innie versus an outie? Should muscles be sewn back together next to each other or on top of each other? I didn't even know there was such a thing.
All right. So anyone who's interested in doing a tummy tuck, anyone who's already had a tummy tuck knows that the belly button is the telltale sign of a good or terrible outcome. So many results online. You go online and you look at these before and after photos and you cringe at the oddity of the belly button. Like, what is that? They're round, they're weird shaped, they're heart shaped, they're all kinds of things. So what that tells you is that belly button reconstruction during a tummy tuck is actually difficult. It requires certain skill sets. So in general, you kind of want a belly button that's puckered and kind of an innie. When you look at young, attractive abdominal walls, you see people who are fit. And I generally like an innie. I'm not a fan of an outie. So what I try to do during the reconstruction is, listen, when you go look at a young person's abdomen, you're going to notice their belly button's tight. It's tightly adhered to their abdomen. When you've had 3 kids or you've lost 100 pounds, your belly button ain't tight.
It ain't gonna happen.
So if all you do is open the skin and pull that old belly button out, you're going to get a crappy result. So you have to tighten and make the belly button snug and small and tight prior to opening the abdomen and trying to take it out. Now, to answer your question regarding the diastasis, if you don't repair the diastasis, there's no way your belly button's going to look normal. I see women all the time with belly button hernias, and they have outies because their belly button's just bulging out because their muscles are completely pulled apart. So in order to get an attractive belly button, you need to definitely repair the muscles, and we repair them side to side, not on top of each other or under each other, side to side. And then you got to reconstruct the stock of the belly button and make it nice and snug prior to opening the skin and bringing it out.
Okay, Mrs. Boussard, is it ever better to split up a mommy makeover?
Listen, I think the answer is it depends. In general, I'm a fan of assuming you are healthy, assuming you are capable, assuming you have the ability. You really want to just knock out surgeries and get them over with. You're not going to want to do your breasts, get a breast lift or a breast aug or a breast reduction, go recover, take off time off work, not go to the gym, have your family help you, all to heal and then go back and do a tummy tuck. It just makes no sense. You're going to want to do your belly. You're going to want to do your breast. You're going to want to do your labia. You're going to want to do whatever the heck you have to do. Get it over with, recover once, recover well, and move on with your life. So what's the caveat? The caveat is you have to be healthy. Period. If you are not healthy, well, what's not healthy? Oh, I have heart disease. Oh, I had a stroke. I have emphysema. I'm a horrible diabetic. I have a pacemaker and I'm on blood thinners. If you're not healthy, then no, you shouldn't do any lengthy surgery. But if you're healthy and you don't have any major medical problems, whether you're under anesthesia 3, 4, 5, 6, 7 hours isn't going to make or break your outcome as much as it is who's doing your surgery and how successful they are. So it's more important for you to be healthy, and it's more important for you to identify somebody who's very skillful. I don't think there's absolutely anything wrong with doing them together, and I highly suggest it.
Well, let's take a break. We have more questions. We have something on leg lifts and male boobs.
Oh, gynecomastia. All right. Well, then stay tuned. We'll be right back with more on Plastic Surgery Uncensored. Welcome back to the second half of Plastic Surgery Uncensored. We're doing your Q&As. That's right. These are questions that you guys have sent in, and we're knocking them out one by one. So, Maria, what do you got for me?
Okay, so the first question we have is from Lala57.
Lala57.
I have flabby inner thighs and no exercise seems to improve it. Should I look into a leg lift? What does it entail? Who is a candidate for leg lifts? I saw an interview with Sharon Osbourne where she says she had it done.
So the question is, what do I do with the flabby, loose, excess skin and fat in my inner thighs? And the answer is you don't have a lot of options. The inner thigh is a little bit unforgiving. Why? Well, the skin quality is very terrible. If you notice your inner thigh, the skin is loose and like kind of crackly, and whereas your outer thigh is thick and full. So once your skin is given elasticity and you have redundancy or fat that's soft, really nothing is going to make it better other than cutting it out. What happens when you exercise? You lose weight, you get fit, and often the skin inside your thighs gets a little looser, maybe a little worse. And so many patients are frustrated because they're getting in shape and losing weight. And while certain areas start to look better, their inner thighs don't always look better. Furthermore, if you go and liposuction your inner thighs, you can already kiss it goodbye. For 100% certainty, you're going to get shitty skin in the inside, and whatever you hated, it looks worse. So then in many instances, the only solution is a thigh lift. Now, the problem with the inner thigh lift is it leaves a kind of a visible scar. Whereas breast surgery and tummy tucks are pretty well hidden, there are two types of thigh lifts. The ones that go in the crease of your groin and the one that goes in the inner thigh crease as if you were wearing pants, and they go up and down. Naturally, every single body wants the one that's hidden in your crease, but that one is a shitty procedure. Why? Because you pull up the thigh and then you cut out the excess skin, and then you sew the thigh into the groin area. And then you walk and you run and you exist, and gravity takes hold, and the scar that you had hidden in your groin is now an inch below your groin and visible all the way across your thigh. So the inner thigh lift that we call a medial thigh lift, I'm not a huge fan of. So that leaves the vertical or long scar thigh lift, which is as if you had a seam on the inner aspect of your thigh running up and down. While the scar is less than ideal in terms of its location, it heals a lot better. It tends to remove the excess skin and fat much better, and it is by far my preferred technique for thigh lifts. Who does this? People with a lot of loose skin, that it's worth the exchange. If you have a little bit of loose skin, I wouldn't touch it. But if you have a lot of redundancy of skin and fat, then this is your answer.
Okay, the next one is from JT Dancer.
JT Dancer, what you got?
What can be done for male boobs?
So let's define male boobs. Male boobs medically is called gynecomastia. And gynecomastia means male boobs. It means that men who have retained tissue in their chest. Now, it can be fat, it can be breast tissue, and most often it's both. It turns out that 2% of all breast cancer occurs in men. So men definitely have breast tissue. So there are two main ways you approach gynecomastia: liposuction and direct excision. So it turns out that usually you need a combination. The liposuction works very well for the fatty tissue in the chest. Liposuction does not work very well for breast tissue that's fibrous and thick. You can't suck out tissue. You can suck out fat. In the instance, if you have breast tissue in addition, you need to excise it, cut it out. And usually you do it through an entry by the areola. So you cut around the areola like you were doing a breast aug in a female, and you go in and you remove the redundant breast tissue after you've liposuction. So that's usually how you address male breast tissue known as gynecomastia.
But if you let's say it's fat and you take it out, won't it sag?
So that's a great question. Like breast tissue in women, there are grades of sagging. Most male breast tissue has yet to get to the level where the skin is sagging, and the skin tends to be a bit tighter than female breast. If a man has lost a tremendous amount of weight and actually has sagging breasts, there is more aggressive ways to do things where you have to excise the tissue and take out breast tissue and take out skin and a whole bunch of other things. But those in men are quite rare.
Next is from BB Theater.
BB Theater.
Is there such a thing as Adam's apple shaving?
You know, that's a good question. To be honest with you, I don't do it. So I do believe that there is a way to reduce the prominence of your Adam's apple. What is it? It's one of your cartilages in your neck. You can't just remove it because then your trachea will be exposed. When we do tracheostomies and things, we go through areas like that. But I think they shave it or they cut it and replace it. To be honest with you, I don't know. But I know it's done during transgender procedures. But no, I don't do it.
I really thought it was a myth.
Maybe it is. Maybe it is. I think it's doable.
Okay, this one is from One Trip Beyond. The science between lipo that uses heat versus laser versus sucking the fat. Which one is gentler as far as the tissue?
We've had a bunch of episodes on liposuction, but I'll re-elaborate basically. So liposuction is a technology where you put in fluid and then you use a big long straw and you suck out fat. Now, the biggest dilemma with this procedure was the loose skin that was left. So over the years, the technology keeps advancing, arguably advanced, I would say keeps changing in an effort to shrink the skin that's left. And so that's usually done by adding heat. So you melt the fat, then suck the fat, and the whole hopes is that the skin heats and tightens so it's not loose. So everyone knows I'm not a fan of these technologies. I think they create a lot of damage. The heat is basically melting and scarifying the deep tissues. It can be done with lasers. It can be done with ultrasound. And to be frankly honest with you, I think they're all pretty aggressive. The idea was that they're supposed to be sort of very stealth, and you just kind of go in and melt the fat, but you're exuding a lot of heat. And the point being that you're shrinking the skin, which I don't think ever really happens. And I think it's damaging. I think the key to liposuction is being incredibly conservative, which nobody wants to do because then it's not satisfying. There isn't enough of a result. Patients are dissatisfied if you're conservative.
Okay, the next question comes from Shelly Avila.
Okay.
I'm considering plastic surgery in Mexico to save some money. What should I do to make sure it's a good facility?
So this is an incredibly important question. So I'm going to repeat it. I am considering having plastic surgery in Mexico in order to save money. What should I do in order to make sure the facility is safe? This question has so many parts to it, I don't even know where to begin. The first part is good for you for at least knowing that you need to check, because just going somewhere without being sure is very highly likely to lead to a disastrous outcome. The problem you're going to run into is you're going to a foreign country. Now, nothing against Mexico. If you said I'm going to Turkey, if you said I'm going to Armenia, if you told me I was going to Costa Rica. Once you leave the United States of America, you're on your own, kid. I don't know how else to say it. There are nowhere near the level of regulations, organizations, authorities, safety measures as there are in America. Don't get me wrong. Shit goes wrong in America all the time, let alone in a foreign country. The problem you run into in a foreign country is, number one, you have no representation. Let's say something goes awfully wrong. Do you know how many patients I've taken care of in my 20 years that had surgery done in another country and just got screwed, stayed there, ICU, some died, some, their parents and family members had to medevac them here. So who's going to protect you if something were to go wrong? Lawyers? Doctors? Who? So I recognize that plastic surgery in America may be expensive for some people. The answer is don't do it. If you can't afford to do it correctly, and by correctly, I'm sorry, the United States is the premier location on the planet as far as safety of medicine. Mm-hmm. Europeans, Canadians, the Japanese, Arabs, everyone in the world comes here for the best care, whether it's neurosurgery, spine, orthopedics. It does not mean that there are not good surgeons elsewhere. I just don't recommend leaving the US. So I don't have a good answer for you. I really think you should save more money, find an awesome surgeon here in the US, and do it somewhere where you have so many protections as a patient.
And the last one we have here is from Kiki Dawes.
Kiki Dawes, last question, Q&A, fire it up.
I don't want my child to feel abnormal if she doesn't develop breasts. Should I talk to her to consider plastic surgery when the time comes?
That's a fantastic question. This talks about so many elements in our society. What do I do as a parent? Do I poo-poo plastic surgery and say, love yourself, and then find out that my child has a great deal of insecurities? Do I support them in this journey and then feel terrible that I facilitated it? What do I do about social media and the fact that my child is seeing these images constantly and comparing themselves? So many good and important topics. Personally, and I can only give you advice from my personal standpoint, I think that when your daughter is old enough, and I don't know how old she is, and she starts to develop, and she gets old enough to recognize some insecurities and start to worry about it, I wouldn't necessarily talk to her about plastic surgery as much as I would talk to her about her own female development and her own sense of security, and have the dialogue and say, hey, I don't know if you're watching images, and what do you think of yourself, and how do you feel about yourself? And if she expresses that she's insecure when she gets dressed, or when she's with her friends, or they're at the beach, or they're in the locker room changing for sports, if she states that she's unhappy and she's already developed like 18, 19, and it's pretty certain that they're not going to develop significant breast tissue by then yes, why not have the conversation? Say, hey, if it's bothering you, this is one avenue we can consider. Because the reality is, if you don't talk to her, she may either go do it on her own and you didn't participate, or B, she just remains insecure for the rest of her life. So it is a very sensitive topic, but before you approach it through plastic surgery, first figure out if it bothers her. Maybe it doesn't bother her. Maybe she's like, I don't mind, Mom. Doesn't bother me at all. I'm very athletic. My boyfriend doesn't care. I don't care. We're all good. So I do think it's a very important subject. And I do think, I am a big advocate of having dialogue. That wraps up another episode of Plastic Surgery Uncensored. I hope you enjoyed it. Continue to send us your questions, your comments, leave us a review. And as always, share, subscribe, and download. This podcast is exclusively designed to give you guys the information that I hope you're searching for. As always, I'm your host, Dr. Rady Rahban, signing off till next week with Plastic Surgery Uncensored.
Thank you for listening to Plastic Surgery Uncensored with Dr. Rady Rahban. We would love your feedback. If you enjoyed this episode or if you find our podcast helpful, tell us why. Leave us a review and make sure you subscribe on your favorite podcast platform. If you have a topic you would like for us to discuss in an upcoming episode, please reach out to us on Instagram at Dr. Rady Rahban, on Facebook at Rady Rahban, or at RadyRahban.com.